they all had chronic Lyme. And I'm like, how the heck did they get Lyme? In Afghanistan, there's no Lyme. But then we found out they all went through Fort Bragg in North Carolina and laid in the bushes in North Carolina for months. Antibodies against all their, receptors to their brain, dopamine, serotonin, norepinephrine. And you wonder why the VA is treating them with antidepressants, antipsychotics. You wonder why it's not working, and 60 plus vets a day killing themselves.
This is Doctor Talks.
Welcome back. We're continuing our conversation on reversing chronic gut conditions. I'm your host, Sinclair Keneally, and today I am joined by the wonderful Dr. Kent Holtorf. He is a pioneering medical innovator and the driving force behind Holtorf Medical Group. His work at Integrative Peptides has revolutionized patient care through groundbreaking advancements in peptide and bioregulator therapies, which now includes pets with peptides. He specializes in a wide range of health issues, including tick-borne illnesses, chronic fatigue syndrome, fibromyalgia, SIRS, MCAS, long COVID, TBI, PTSD, neurodegenerative diseases, autoimmunity and inflammatory diseases, GI dysfunction, healthcare reform, and evidence-based medicine. So what I love about Dr. Holtorf's work is that he has taken his own personal experience from reversing quote unquote irreversible heart failure caused by chronic infections and used his innovative approaches to creating these products that are actually very easy to use, very well tolerated by even the most sensitive of folks, which is why we rely on them so heavily in our practice because we get really complex chronic illnesses walking through the door all the time.
For all your sins.
Right. Yes. And yeah, so making this easy for people to reach these tools and to actually be able to use them. So thank you for your work. And we're really, so let's talk about immune dysfunction and how, let's see. I want to cover a lot with you. So let's think this through. I want to talk about immune modulation for autoimmunity and chronic inflammatory conditions. Can you discuss how the thymus is involved and what does it do and what this immune shift is
Yeah,
that we're
and it's
autoimmunity?
really revolutionized everything that we do. I mean, it saved my life. And I had chronic Lyme, Babesia, Bartonella, was on 7, 8, 9 IV antibiotics at 3 to 5 times the max dose, which I would never give to a patient. And I just did nothing, and I'm in the ICU. And I remember the nurses are making a shift change, and I hear the one go, "This is that AIDS patient who keeps turning up negative for HIV," because I had no natural killer cell function. It was zero. So no
Mhm.
wonder the antibiotics didn't work. And, so modulating the immune system. So if you think of it as, the immune system is very complex, but really clinically, you can break it down. And Th1 gets stuff inside the cell. Th2 gets stuff outside the cell. Then over here is also Th17, which causes autoimmunity. And on this side, also Treg. So as you get older, just from getting older, and also if you have more stress, environmental toxins, like, oh, that's not a problem. And, or, weight, metabolic issues, poor lifestyle, whatever. So the thymus starts involuting, and that controls this ratio. So even just as you get older, the Th1 goes down. So now you can't fight infections, but now you have all this inflammation going on. And so really it's an aged, phenotype of the immune system. And that's why, and if you look at, so the thymus starts involuting around teenage years, and it drops down to its lowest point at about 45. And a little bit after that, that's when you see all those diseases of aging go up, right?
Mm.
And, so the autoimmunity, cancer, osteoporosis, cardiovascular disease, all that stuff. So if you can bring it back, now there's a study, they just did another one on it where they did growth hormone and some metformin and barely made the thymus bigger. Like, okay, it was like a big thing. And well, hello, we have thymic peptides that are safe and effective. Just give the thymic peptide. So you want to bring that back. And yeah, so it's going to lower the inflammation and raise that Th1. And really, your immune system is the number one biomarker for age. And basically in how healthy you are. So really, anything you do now. Also, then if you get chronic infection, stress, especially emotional stress, it's a kind of interesting how that works, and also how it drives mast cells, and really everything we see chronic inflammatory disease, autoimmunity, degenerative diseases, even osteoporosis, that it's the immune system that's driving all that.
Okay, so that's a really great like base layer of foundational context for us. How does that relate specifically to autoimmune gut conditions like, for example, colitis and Crohn's?
Yeah. And so, I mean, it's especially like direct, correlation with autoimmunity and inflammatory. So, just and if you look at, inflammatory bowel disease, they likely have also Hashimoto's or, or some other autoimmunity that's going on. Something that goes up and down or chronic infection. And what the studies actually show, if you have toxins and a chronic infection, you're going to get autoimmunity, and especially a lot of times to the brain. And with the we've been doing, treating all these veterans that were, special forces guys that were 100% disabled, and we were doing paying for everything so we could get great tests. We kind of tested everything, and I thought they'd be all over the place, right? But we found that they all had the worst immune system you can imagine. Their telomeres were so low. I mean, and these guys they look like they're in good shape, but they were like 10 years older than their chronologic age, 20 years older, and, tons of toxins and tons of inflammation, a lot of that traumatic brain injury, so they all got their guts are just a mess. And what we found is they all had chronic Lyme. And I'm like, how the heck did they get Lyme? In Afghanistan, there's no Lyme. But then we found out they all went through Fort Bragg in North Carolina and laid in the bushes in North Carolina for months. So, and they all ended up with PANs, so antibodies against all their, receptors to their brain, dopamine, serotonin, norepinephrine. And you wonder why. Okay, the VA is treating them with antidepressants, antipsychotics. You wonder why it's not working. And 60 plus vets a day are killing themselves.
Right.
And so we got these guys better, and now they're so grateful. You think special forces guys, I mean, they are just so humble, and because they don't have to say it because they know they can kill you. So it's like, if you don't get me better, I'm gonna kill you. Okay, I got a incentive here. But no, it was really satisfying. So, and then we actually just got a grant to publish that data. So hopefully that will be coming out.
This is such an amazing correlation to be able to like finally put together. And I love how you simplify it. Toxins plus infections equals autoimmunity.
Yeah,
So,
there's a number of studies, I won't go into, but that demonstrate that. Well, there's one that was like a cobalt mine in Africa, and they all had these, you know, tons of heavy metals but no autoimmunity except for the people that got malaria. And once they got malaria, boom, it was like autoimmunity central. They end up being disabled and all that. That's just one of the studies, but there's a lot of other ones demonstrating that as well.
it's super interesting. So what can we do about this? Using like you talk a lot about, these key peptides for
Yeah.
IV, for example.
Yeah.
Maybe unpack those for the audience.
Yeah. So, and then we got the bioregulators, which are really exciting now. But in terms of, so you want to give a thymic peptide, right? So you to actually will boost that TH1. So you can use thymosin beta 4, thymulin. Okay, those are injectable and they've been banned basically. But
Mhm.
actually, the thymus basically is about 100 times as potent as the thymogen. So thymogen, which is orally active, is shown to be dramatically many full times as potent as the injectable. And
That's
then
so
there's
interesting. I didn't know
another
that.
bioregulator, Bilon, which is also amazing. It's classified as a thymic, splenic, also pituitary bioregulator, and it does so many things: lowers inflammation, modulates the immune system, and then you want to boost that side. Then you have things to calm down the Th2, which would include BPC, which also kind of repairs everything, TB4 frag. So the TB4, which again was banned, 43 amino acids, it will not absorb. But TB4 frag will. And it actually, in TB4, has multiple domains. So like the first part, which we use is the immune modulating part. There's a part that stimulates mast cells, right? And then there's parts that do different things. And so it cuts out the part that stimulates mast cells. For normal people, the mast cell part kind of helps heal, but
Right.
for our patient population, like, yeah, you don't want that. It's shown to like heal, reverse, basically MIs and things like that. And then KPV is really pretty amazing. It is the last three amino acids of alpha melanocyte stimulating hormone, and it's super anti-inflammatory. So it's great for mast cell activation. But
Got it.
the interesting thing is that it actually improves immunity, So it's kind of like giving a steroid that improves immunity. It's also very antimicrobial. It's more potent against, for instance, fungal. And there's a lot of studies showing fungal infections and Crohn's and irritable bowel disease is a major issue. It was more potent than diflucan at 1/1000th a dose. So against Staph aureus at like 100 times. So 1/100th a dose. So and if you go to myrecovery.com, there's a patient, it wasn't our patient, she had a blog. She has autistic sons, had a big blog, and then she got long COVID. A lot of gut symptoms. She's a big following, and everyone has gut symptoms. And she took the KPV, and it's like, oh my gosh. And then all these people are going on like, oh my God, it made me so much better. And I'm like, stop. It looks like it's like they're made up because there were so many. But and she's so nice. She like we donate stuff to her, and she just gives it out to all the people. But it really is it's a nice review of KPV, and and these are the toughest. They're all super sensitive, and we're like, wow, it was just overwhelming. But so KPV is great, and then so BPC will basically lower that inflammation. TV4 frag will work on the tight junctions, okay, and then KPV will not only lower the inflammation, also work as an antimicrobial, and also balance the immune system. So those three are key.
I have a funny story to tell you about KPV before we move on. A couple years ago, all hell broke loose in our clinic and in our practice and could not figure out what was going on. And we've always worked with very sensitive folks. I call them pioneers because they're super gritty. They're tough. They're willing to do the work, but they could be really sensitive. And that's the whole point, how they end up in our practice. And for some reason, for a few weeks, everyone was having a huge increase in symptoms. And we realized it was because KPV was out of stock and they were all
That's funny. Yeah, it's like it's pretty amazing. And now the one that
wasn't giving it the credit due until then.
there you go. And actually the one we use is an isomer.
Mhm.
So it's a naturally occurring isomer, and it has about 20 times the half-life.
Oh, interesting.
Yeah. And same with we can talk about the BPC, stable BPC versus the arginine BPC, which they call stable BPC, which is really unstable BPC.
Well, so if it's 20 times the half-life, what is the half-life for your KPV with that ice?
Yeah. So the normal is about, I think, like 20 minutes, and now it puts it out days.
Nice. Very cool. I'm sorry, I interrupted your train of thought. Were you gonna go on to the bioregulators?
Yeah, and then sure. And also there's with the bioregulators. Okay, what is a bioregulator? Or let's say, well, what is a peptide? Okay, so peptides work differently than hormones. So let's say hormones go into the cell, basically will attach to the DNA and repressors or activators, and work slowly on, slowly off, and kind of change things in a broad sense. And then peptides work on the cell surface and have pleiotropic, multiple effects, right? And you kind of think, well, seems like they would have more side effects. But it's the opposite because, like supplements, they're very much like supplements. So supplements have a lot of effects. But this happened to, this one keeps this from happening. But when you have a drug that goes, super targeted, like it messes everything up because the things can't compensate. And now the bioregulators, they're by definition less than 4 amino acids long. They are orally active. They're so small that they don't get broken down if they're acetylated and amidated. And they also go in and attach to the DNA and work that way. And they work very epigenetically. And so they will just happened to like turn on all the anti-aging genes and turn off the sickness genes. And there's so many studies, like you look at, yeah, thymogen and cancer. I mean, it's just like incredible. Epitalin, and they would give this was a 15-year study on people with significant heart disease. They gave them epitalin, which is the pineal peptide, and followed them for 15 years, just 6 doses. The ones that got the epitalin, another part that they also gave them the thymogen, and they had dramatically less cardiovascular disease, mortality, morbidity. Their quality of life was better. Their cardiovascular system got better, not worse. And you can see all these things. And or like epitalin, what is like they'll give it to, and we use it for fertility. Like they gave it to menopausal rats. They all started menstruating. 25% had normal live births. So it is, if you add a pineal peptide and a thymic peptide, it is certainly the best anti-aging insurance policy.
Wow, interesting. Okay,
Mm.
so talk to me about how that applies to our guys with chronic gut conditions.
Yeah.
Anything that they need to think about as they layer these into their protocols?
So, yeah, when you look at, the gut brain axis and the brain gut axis, and the nice thing about the peptides, because, people always think kind of gut brain axis, like with all these neurodegenerative diseases, the gut is making a big difference, but also the
Right.
brain totally affects the gut. So peptides work on both sides of that. But, although one, article is actually reading, I don't know, like 6 hours ago, but they found that because they used to think that there are multiple mechanisms, but they thought it was like the brain's effect, like causing ulcers and things, but they found a huge effect was due to the pineal, hypothalamic, pituitary, adrenal, and thyroid axis. So, and this was a thing we found out, is if you look at these patients, they often have low cortisol, but very high ACTH. And so what that means, the body's pumping out corticotropin releasing hormone, trying to get that cortisol up. And CRH, corticotropin releasing hormone, is a huge direct stimulator of mast cells and inflammation. And so, so you really want to work on that HP axis. So you can take the pineal peptide, the adrenal pineal bioregulator, the adrenal bioregulator, and also the thyroid is shown to play a big part. And all these people have low thyroid, but their TSH looks normal because they have pineal hypothalamic pituitary dysfunction. So the TSH is low and their thyroid's low, but you're taught in medical school, thyroid's easy. If your TSH is high, your thyroid's low. If it's low, you're high. If it's normal, it's normal. So they don't show that they're actually low thyroid, but huge effects on the gut. And we check everyone's through a Thyroflex, which the British Medical Journal showed it was a better test than blood test for thyroid, measure tissue level. And we'll check everyone's basal metabolic rate. And pretty much every single person that comes in as chronic illness or has dieted significantly has about 25% lower metabolism than a person of their same age and weight. So they're actually only burning the calories for a person who's 60% weighs 60% of what their body weight is. So, with no metabolism, there's no mitochondrial function and all that. So you want to take care of that. And the thyroid bioregulator is amazing. It's like you give it, and let's say you have high thyroid, it brings it down. If you have low thyroid, it brings it up. If you have Hashimoto's, dramatic reduction in the autoantibodies. And so really, and that's I have a talk coming up with the 11th on, it's part two of the thyroid on T3 and peptides and bioregulators for Hashimoto's and, and low thyroid. But yeah, and so, I mean, all these things are amazing. Or like the kidney one, I had some leftover chronic kidney disease from the infection. And so
Mhm.
like creatinine would run like 1.3, but I would take a thyroid bioregulator, and there's a little too much information, but I know it was always dumping protein in the urine because the urine was very foamy, right? So you take
Mhm.
the thyroid bioregulator, and about 2 hours later, and for about 3 days, there's no foam in the urine.
Interesting.
And we give it out to like one of our employees gave it to her mom was on dialysis and forgot about it. And she goes, "Oh, my mom called me and says the doctor can't believe it. never seen someone's kidneys get better on dialysis, And but so there's also a gut bioregulator, okay, which lowers the inflammation and it works like great for it goes, especially you take give it along with the BPC and the other ones. And then there's a which isn't, I don't know if I call it a bioregulator, but we discovered a anti H. pylori bioregulator, totally non-toxic, that just wipes it out. Because H. pylori, actually think it's just a local infection. It causes the same immune shift and all those problems. And you look at these people, a lot of them have H. pylori but they don't connect it. It's also kind of a marker of low immunity and a cause, like so many things. A cause, again, everything's a
Right.
cycle. So then you get that pineal hypophytic pituitary dysfunction, you get mitochondrial dysfunction,
Mhm.
you get immune activation of coagulation, and then the leaky gut, and then all that. So yeah,
And they're not producing enough stomach acid because H. pylori bumps up
yep,
the on from like a 2 to a 6,
yeah.
so it's really
And
hard to break the
and then
food
you can
down.
give the pancreas bioregulator, which
Ooh,
which actually now it's like we've had people with type 1 diabetes start making insulin, and type 2 dramatic reduction in their blood sugar and inflammation.
post-COVID, that would be so important, like the
Yeah,
pancreas.
or the heart has been a lifesaver, and people, with the palpitations and the, myocarditis and the,
Right.
endocarditis, and the best thing for it, along with BPC, KPV, TB4 frag, and TB4 frag, it does a lot of things, but it kinda gets labeled with what studies were done, right? So there are a ton of studies done on heart and showed that it rejuvenated the heart with, from MI and stuff. But also you also gotta realize too that for autophagy, right? So the body, it's really a hot topic now because with anti-aging, that your body needs to be able to recycle these cells that basically, when they're like basically oxidative stress, they get damaged, and the mitochondria sense you're basically when there's something going on. So they'll go into cell danger response, which instead of now making energy, they start pumping out reactive oxygen species. So they're basically not doing what they're supposed to, but they're making everything worse by increasing inflammation. You look at diabetics, congestive heart failure, like most of their cells are senescent. And now, and the reason that they're not getting wiped out is that Th1, the natural killer cells, need to be able, they're just too weak to go get rid of those.
Mm.
So you want to boost that, and that you'll be able to start, killing off these. When I say recycling, it's very healthy. You're getting rid of the gunk, and then they can start, and then all of a sudden the inflammation goes down. You can give like direct senolytics like foxo4 DRI or dasatinib and fisetin, and things like that. So it's a really hot topic in terms of aging and chronic illness. So we'll have like chronic Lyme patients, and they're just stuff. And then we'll give them the senolytics, and then like all of a sudden inflammation just goes way down. Same thing. Um, or for instance, we had let's say our last Crohn's patient was a 9-year-old who came in scheduled for colectomy, and so said nothing worked. She did all these alternative, all the standard stuff, and we take out her colon. And so we talked to her and went through all this, and she's very conservative though, and so we gave her she wanted to do just BPC. So with that, probably her symptoms dropped by 50-60%. Then we added, KPV, and then thymogen alpha 1 was the thymogen and Vilon, and the
Mm,
KPV, and essentially eliminated all her symptoms.
wow.
And it was funny because she went over to this person's house and told them, "Oh my gosh, this Dr. Hofferhorf or something like that, like he doesn't have to get her colon taken out." And he goes, "Is it Holtorf?" And she goes, "Yeah, do you know him?" He goes, "Yeah, I work for him." So it was kind of funny, but yeah, but and that's what we see. It's like standard medicine is just failing in so many different ways. But I don't want we don't get don't get into that. But there's so many ways to like look at the underlying issue and treat it.
I really appreciate you saying that because obviously, you know, the folks that are watching this summit have been down a really long road but they have to suffer for years, if not decades, before finally getting a diagnosis, only to be told, well, the path for you was let's put you on some immune
And they're
suppressant.
made to feel like maybe they are crazy, that they're making up the symptoms.
Yeah. Yeah. And that it's just about managing the symptoms and, hopefully avoiding surgery. It's a really dismal picture that Western medicine
Yeah,
is making.
and
So,
it's like so many things, and this immune modulation, like ALS patients that come in wheelchairs, they're jogging, and they go back to their neurologist and they go, "Oh, it's it's not curable, so it must have not been ALS." Well, 3 of you diagnosed him, but, there's just so many things like that, and all these neurodegenerative diseases, and there's some good peptides that are they're stuck because someone's paying for these not to go through. And, yeah, they just approved one that 60% of the people approving it had stock in the company. Th
shocker, right?
Yeah, this is what we're getting down to, you know?
So
But,
that
yeah, I wanna mention, Akkermansia, the probiotic, which is really unique. It's kinda hit the market because it was shown that inverse correlation with weight, so the more Akkermansia you had, basically the skinnier you are, and it basically goes into it eats mucus. But so it goes into the mucus layer, and so it has very close connection to the cells in the gut lining. So it's a
mhm.
very profound effect. But it actually kind of eats mucus. It may be bad, but it actually ends up increasing the mucus layer and dramatic reduction in permeability of the gut. So that's another one that we found. And there's a number of studies on in immunoglobulin. Uh, so we have that with BPC, KPV, Vialon, Akkermansia, prebiotics, probiotics, and the IG.
Yeah,
Um,
can you talk about gut feeling and what that product does versus like other, general gut support? Because I think that this works completely differently than other
yeah,
probiotics.
yeah. So we kind of again, what we're going to do with the bioregulators is group them together because right now they're like they're in Russian and there's extracts and synthetic, and you're like, what the hell is
What's going on?
da- da, you know? And so we're gonna put them all together, and so it's like here you take this, and for gut you always want the immune and the brain, all that stuff, but we basically put the BPC, the KPV, and the Vylon together, and then with the IgG and the Akkermansia as a formula. So it's just all in one. It's a powder now, but we're also going to put it in capsules. And then we have coming out a liposomal brain formula, combination of 3 bioregulators, and also a thyroid bioregulator, which has 3 thyroid bioregulators in it, and a pineal. So we're trying to make it easy and normally, like those, they're about, let's see, retails usually $1 to $2 a capsule. Will be like a fraction of that cost.
That's really amazing. So is that like I'm thinking about the typical person listening to this who has a lot of food sensitivities, probably histamine sensitive, if not, full blown MCAS. Also, obviously, serious bowel dysregulation, mitochondrial dysfunction, for the long term may have additional autoimmune conditions, like, for example, Hashi's. Where should they start when they're thinking, okay,
Yeah,
peptides to reverse my Crohn's or
yeah. And that's why I mentioned something about, the all these food sensitivities now.
yeah, yeah,
And it's really any infection, any toxin actually is gonna magnify that like crazy. Well,
absolutely. Yep.
BPC is shown to bind up the toxins and not only kind of bind them and flush them out, but also prevent the activity of them. Like it also will, like, EMFs, and these patients are really sensitive to EMFs and they'll get palpitations, all this stuff. So it actually blocks doesn't block, but it modulates the abnormal calcium channels in the heart
Mm,
like it does for other toxins. So they don't have the side effects in it. And so they don't have the palpitations. And it also like prevents overdoses of meds. And it's kind of a smart peptide in that, let's say your blood pressure is low, it raises your blood pressure is high, it lowers it. If you're hypercoagulable, it basically, makes you less. And if you can't clot, it allows you actually the bleeding time goes down, but stops that hypercoagulability. So that's probably like I would say start there and then add in the KPV, the thymogen alpha 1, which is again the thymogen. So you're going to boost that, the Vialon, which
Right.
has that effect. And I mean, the gut product is probably a good start, but then also really do the pineal and brain because it is like, again, their thyroid screwed up. They don't know it. Their HPA axis dysfunction. Like I did a review article, HPA axis dysfunction in chronic fatigue and fibromyalgia, found that 90+% have adrenal dysfunction,
Mm.
but it looks normal on the blood test. And if you see someone with a high ACTH, okay, and you'll see this, but low cortisol, those are it's going to be like very typical. And so you can either give a little cortisol, but if you give the pineal bioregulator and the adrenal, that will.
Mm-hmm. So, what kind of time frame are we looking at to be on peptides before you start seeing, or these bioregulators before you start seeing some shifts and some symptom relief?
Yeah, I mean, everyone's different. Bioregulators, God, I've seen them. And I say, well, they're kind of made for kind of long term because there a number of studies are coming out where they put people on them. 3-year studies coming out, and the people lost on average it was 5.5 biologic years. Some lost 17. But they'll
Over
actually
what period of time? The 3 years?
those are 3 years. Yeah.
Okay.
And didn't have them change anything except just take those. But you don't have to take them forever because you look at those studies, like they gave 6 doses and 15 years later, they're still reaping the benefits. So the standard way is like well, y'all do usually 60 days worth of different ones, but then and everyone has their own different protocol, but it'd be like, okay, you do 10 days, you know, and then 3 months later, you 10 only 10 days. And then but there's a lot of them, so you gotta, like, rotate, and you're on something all the time, but that's why we wanna put them all together
Mm,
because so you're just not taking, like, capsules forever, so
right. That's a really good point. So, and that feels more doable when you think about it that way, because everybody's telling you to take something, and
yep, and it's like, "Oh, you gotta
like
take
a
this."
full
It's like
time
yeah,
job to recover.
yeah, it's like, yeah, capsule fatigue, definitely.
What do you think is the most overlooked tool in your peptide or bioregulator toolkit for Crohn's and colitis right now, out of everything we've talked about today?
Uh, I would yeah, you'd think I'd say the gut one because it does work in terms of bioregulators. Would say the gut one because it works really well. But really, it would be the pineal or the epitalon, pinealion, which is like a subcortical, and the thymus bioregulator,
You choose those.
because that is going to modulate your whole immune system.
Hmm.
And so you're over here, but now but you wait, why are you treating over here? Because that's the problem.
Hmm.
Yeah.
When you talk about immune modulation, can you just, for the newbies in the audience, really underscore the difference between these tools and the immune suppressors they might get prescribed? Because those come with such high side effects
Oh
versus
yeah.
true
Yeah.
immune modulation and how supportive that is.
Yeah, and so what the typical immune modulators, let's say immunosuppressant, they'll knock out like a cytokine or a particular white cell, and it's like it just now your body can't. It needs some of that, right?
Right.
And so you end up getting you know chronic infections, cancer,
Parasites.
all
Yeah.
this stuff. Yeah, and candida, which now we're finding, and other fungal infections that are a major issue. Well, these actually improve your immune system. See, but it's not about lowering the immune system, it's about modulating. But these things lower. And it's like if you give steroids, it lowers. When people think stress lowers your immune system, it modulates it. So it lowers that Th1, but raises that Th2.
Right.
Emotional stress is huge. Like it is like, death or a divorce or something, that's when people all of a sudden and if someone's in a very stressful household, like let's say they're with a narcissistic partner, they are the toughest to get better.
Yes. Yes, I know that one from experience.
And I don't know, there's something going on. I'm not going to blame the recent treatment that was, but it's like it's just exploding,
It is. Yeah, it's bizarre.
especially here in California.
Mhm. We'll call it an invitation to heal is what we'll call it.
Yeah, there you
The
go.
belief it's not too late.
Yeah. I'm not so good at framing things.
Uh, Speaking of, for the practitioners in the audience, what advice do you have for them? Because we obviously want them to get peptide lift.
Find another job. No, I'm
Very
kidding.
serious.
I'm kidding. Yeah. So really, it's like, and we're gonna start a year-long training. It's launching in August, and it's called Peptides, Bioregulators, and Shit That Works. You know, and because people go to all these conferences, and it's just blah blah blah.
Yeah,
Like all this minutia, and they're because of the CME, they can't like tell you what lab or you can't get
right.
these studies, and uh, and so we really want to like, it's gonna be our, like, duty to make sure everyone totally understands and, like, passes through, so we're set up like, we wanna really set up a community and, you have a accountability partner and all that stuff. So we're
Nice.
trying to make it a thing, and you can say, "Look, oh, well, something else, the treatment, we need a lecture on this." "Okay, we'll do it." So we're trying to change that whole thing, and that will be available coming up soon, but yeah, I mean, it's kinda like with the peptides, and but when I started my practice, actually, it's when I was sick, and I wouldn't even go to a alternative conference 'cause you're told that it's no evidence, and then when I finally did, 'cause no one's getting me better, I'm like, "They've been lying all this time." It's more evidence-based than the stuff that they're telling us, and I started, I went into anesthesia, which is mindless, but anyways, I don't wanna say that. I get complaints if I say that, but, it wasn't for me, I'll say that. But went into family practice, and then I just took over a practice, and I, found for me, T3 was awesome, and then I found it was great for almost everyone else and called the Thyroid Optimization Clinic, and we converted the practice to cash within a year, and we didn't have to advertise. It was just people waiting, and that's just T3. So if you use T3 really well and the peptides, and let's say throw in some ozone and some other stuff, like you can treat 90, I would say almost everything that comes through your door. And these are including people that have been everywhere and didn't get better.
Yep.
Uh,
Yeah, we often combine peptides and ozone and with pretty much everything you said.
yeah. And yeah, you see the things that work are generally immune modulators,
Right. Yeah.
and, uh,
But also
and
take into account the level of toxicity your body has been subjected to.
yeah, and if you have low TH1 though, you don't detoxify. And
Right.
and so I have that ebook out, which everyone's welcome to, the peptide protocol for the rapid treatment of sears. And because I had so many of these sears patients coming in, and they're like, "I'm on binders," and I'm like, "How long you been on 'em?" Like, "9 years." I'm like, "Okay, but I know I'm gonna
God.
get better. Like Shoemaker says, I'm gonna get better." And I'm like, "Okay, I'm way too ADD for that. Let's just fix." So what the difference is, and Shoemaker's done such a great thing for the illness, and I would never,
Wonderful
disparage it.
advocate. We're just saying there's layers of
Yeah.
today that it doesn't go
But
current.
the whole strategy is get rid of the toxins to raise the immune system. So just go right to the immune system, and now you can get rid of the toxins so much easier.
With way less trauma. Yeah.
Yeah. Yeah, so it shortens that path from, and we'll use antibiotics, like, for chronic Lyme, but most time we don't.
Yeah, we never use antibiotics for Lyme. We get great results. And in part that's because of peptides and ozone and, knowing when to
Yeah,
like
because
what.
most people that have Lyme don't have symptoms. It's when the immune system, then they get something else, and now it just comes out, and then now it just wreaks havoc
Yeah, it's really
with
an
the immune
unprecedented.
system, yeah.
I totally agree. Yeah, it's so fascinating. And I hope this is giving people hope because it's never too late. I mean, we're talking about aging backwards. We're talking about reversing autoimmune diseases you've been told you'd have to live with forever. Like this
Or like
is
MS, it's like, "Okay, well, we'll be out, you'll be fine in 2 weeks," It's
there's a range, but yes.
yeah, but it is like the
People some
plague and
breathing.
like, yeah, or scleroderma,
Mhm.
okay? Scleroderma, I can show you the studies, is a symptom of Lyme. Okay, and we had a guy who went to the Mayo Clinic and he had scleroderma, just he was just dying basically. His body was deteriorating. They said, "We can't do anything to you, can't help you. Go I'd suggest you go to Hawaii, smoke pot, and die." So he was on a plane to Hawaii and to go die and smoke pot. And he happened to sit next to this doctor I know, and they ended up talking, and she goes, "I think you should go talk to this doctor I know." So he gets lands, he comes back, and then he comes in. Long story short, within a number of months, he's totally fine. And he had Lyme, of course, because it is a marker of Lyme.
Right.
And now he was happy, but now he's really pissed, of course, right? And he moved to Washington, D.C. to be an advocate. We saw the lady goes, "It's impossible," but yeah, I mean, there's so many cases, all these, and everyone has this chronic multi system illness. Are you seeing this? I don't know. I'm getting all these patients, kind of same, multi-system illness, but anxiety is their number one thing. They just can't, they are just so anxious and depressed. I'm like, I don't know, I just got a couple in a row or something, but I
No,
mean,
it's really common at this point. We've seen a huge uptick in that as well. And I think that's obviously it's the bugs. And
yeah,
anxiety is not an emotion, guys. It's an overexcitation of the nervous system.
it's
So
brain on fire.
exactly. It's brain on
Yeah.
fire. And so it's infections, it's toxins, and it's absolutely reversible. Anxiety is not your temperament. It's not who you are.
Anxiety sucks, it is. It's like, I'll tell two things that
Rotating.
suck. There's two things that suck. Not being able to breathe,
Yep.
like heart failure, not fun. And then anxiety because it's just like you're doing like what is it when the people go into jail and they're coming off of stuff and they're up like oh so they do double time.
Draw.
So you're miserable like you can't even go to sleep. Yeah, then you get allodynia. I had that. That's fun. Touch your skin and like you know yeah. And people don't feel too sorry for you when you have allodynia because they don't get it. It's just like you touch me. You know.
Oh,
Like,
I know. And well, I mean, the problem with all this multi-system chronic illness stuff is that you usually look fine and you can fake it for short periods of time, even though your life is ruined and it's shrunk down to the size of your symptoms. I remember
and
this very well. I remember being told that I was faking it by the people who supposedly love me the most.
yeah, because I'm telling you, even people love you, there's a limit to their empathy. It's like when you
Actually,
start
yes.
saying stuff like, "Well, why don't you just go exercise?" Or if you just eat better, like, "I'm going to punch you in the face."
I actually have a theory about this. I think
And
that our
doctors are the
loved ones
worst.
are often the worst and the least compassionate because they're so attached to us returning to normal.
Wait, who?
They Our loved ones, they need us to be back to normal.
And they
S
want it so bad, then they're pissed.
Yes, so they wanna stabilize the family unit, or your partner is like, "Hello, I need to be able to count on you," or raising kids together, or your boss, or your colleagues, or your friends are like, "When are you gonna be back to you?" And you're like, "As soon as I fricking can, I'm
And
doing
plus they're like,
everything
"I
in
want
my
you out of
power."
the house."
Because it's more work for them when you
And
aren't
and it's
yourself.
it's it's tiring for the caregiver,
It
and
is.
especially when they look fine, like, "I have to go get your food, really?" You know? And,
Yeah, they're not always there.
and but doctors are I just the horror stories of the things that they tell patients. Like, if a doctor can't treat it, it doesn't exist. It's the patient's fault, right?
It is appalling, the standard of care. The number of things people have said to me walking into our practice, like, "My GI doctor said it doesn't matter what I eat," or "I will always have this, it's only gonna get worse," or "I'm looking at
Or
switching
it's
away."
genetic.
Oh, it's genetic, that's my favorite. My god, if one more person says that to me, I'm gonna lose it.
Because, yeah, for the listeners, genetics maybe 20%, and that's being generous. Epigenetics, you can turn
Maybe.
these genes off, you can turn the genes on, and we're not ruled by our genetics.
Yeah. Notice we've been talking about autoimmunity for an hour and we never once said genes. We talked
Yeah,
about toxins, infections, stress. We didn't say anything about genes.
yeah, yeah. I mean, there's tons of
And we're the ones that get this
predispositions.
reversed. So listen to us.
Yeah, it's a predisposition, but you can check that out. Or it's
Yeah,
kind of like with the
that's
people
all
with the
it is.
BRCA gene and when angioedema cut their breasts off. I'm like, no,
I
no.
know. I know. It's so sad. That is medical trauma. That is medical malpractice. Woo, you're getting me fired up, Kent. Well, of course, that would have to be our interview. I've really enjoyed this. It's always
No, I always have the best time with you, and keep up the great work, by the way.
thanks back at you. I just love watching you expand your set of tools that's available for everybody. Do you have any last words of wisdom for our wonderful audience today?
I would say oh, there's hope. There's way more than hope.
Yeah,
Like, you should get better. You deserve to get better. And just the days of listening to your specialist and doing whatever they say is gone. Okay. You have to take an active role and in your healthcare, be open minded. But, I say, don't trust me. Go out and read everything, come back and say, oh, this says you're full of crap. Okay. Well, let's talk about it. And you'll have doctors go, if you read Dr. Google, you can't be my patient. Run from that doctor.
serious.
Come back with all the questions. You know, you, you basically, it's great. Just get a ton of information and then just clarify. If the doctor's not willing to justify their treatment, I don't think I'd go.
Absolutely. I completely agree with you. The days of doctors saying, "Don't confuse my medical degree with your Google search," are over
Ugh.
because that what they're really saying is, "My 1 to 2 hours of education on your
And,
condition is more important than your lived experience."
that was so well put. That just, for some reason, that just hit me because it's just like, you don't have a doctor. Like, okay, that's all you have going for you. It's like, And you
We're living
haven't
in the
done
wrong
and you
century.
haven't done any continuing medical education since you graduated 30 years ago, and you're still doing the same damn thing that you were then.
You were never sick. This is all hypothetical for you. So,
Yeah.
yeah.
Anyways, we didn't mean anything bad. We're just kidding.
We're just teasing, guys.
Just
It's fun
poking
'cause
at
this is
them.
our passion. We love our colleagues. We both train our colleagues, our practitioner friends. We want everybody to have access to this information. So where can people find you, Dr. Kent?
I'm usually at my desk for 3 days at a time. They call me at 3 in the morning. That's my
How come you never get back to me then?
Huh?
Rude. Rude.
No, because to tell you the truth, I can't keep up with my emails, and I don't even look at my phone because I just get I've given up, and I've had, hired all these basically assistants, and they're just like, and they have a nervous breakdown. So I'm getting some from out of the country. I'm gonna have 3 that are just gonna monitor my emails. So then I can, yeah, 'cause people are like, "I've been emailing, I've been calling," like, I can't even look at the phone because if I do, it's there's a whole day. And
Yeah,
then
what was that about anxiety? No, I'm just teasing you.
the so, yeah, we're at, Holtorf Medical Group, in El Segundo, and we're gonna be launching a telemedicine group, and, we got the peptides out, and then integrative peptides, and then we're doing some clinical trials, and, probably gonna also working out and becoming a professor in Mexico, so we can even expand a lot of stuff, like, the anti-C, and there's so many treatments that are just like non-toxic and effective. And, we can even you do even more down there. And so, yeah, kind of good stuff going on. Just, I was trying my, don't sleep for 3 days, then sleep. And, I don't recommend that. I think it aged me. It's like, but, it's all good.
Thank you so much for your insights today, your clinical wisdom, and also just some really great big picture, awareness of the tools available to us. So,
Thank you.
thank you.
Appreciate it.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.